Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Hello, everyone, and welcome to the podcast. Today, I am honored to introduce Dr. James Greenblatt, a globally recognized pioneer in functional and integrative psychiatry. With over 30 years of clinical experience, Dr. Greenblatt has dedicated his career to transforming the treatment of mental health disorders through precision-based approaches that integrate laboratory testing, nutritional interventions, and root cause analysis. Dr. Greenblatt earned his medical degree from George Washington University and completed a psychiatry residency before pursuing a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. He has since become a leading educator, serving as the assistant clinical professor of psychiatry at both Tufts University School of Medicine and Dartmouth Geisel School of Medicine. A prolific author, Dr. Greenblatt has written 8 books, including the bestseller, Finally Focused, The Breakthrough Natural Treatment Plan for ADHD. His latest work, Functional and Integrative Medicine for Antidepressant Withdrawal, provides groundbreaking insights into a major challenge in mental health care today. In 2019, he founded Psychiatry Redefined, a continuing education platform for clinicians looking to integrate functional and integrative psychiatry into their practice. More recently, in 2024, he launched Mind Refined, a consumer education platform aimed at bringing functional mental health care solutions to the public. As a sought-after international speaker, Dr. Greenblatt is at the forefront of reshaping the future of mental health care. Today, we'll explore his expertise, groundbreaking research, and the role of functional medicine in achieving sustainable mental health. Welcome, Dr. James Greenblatt.
Thank you, Ginger. It's good to be with you.
I'm so excited to have you on the show, and I'm going to tell you a little bit why. First and foremost, I've worked with psychiatrists for many years. I work with a large group in Las Vegas, and I love them. They're great. In fact, I think I introduced them to you. And so that's number one. Number two, I'm very passionate about mental health. I'm in recovery myself, coming up on 17 years. I'm in recovery from alcohol addiction. So mental health has always been a passion of mine, and supporting mental health and really breaking the stigma and the shame behind mental health disorders, and letting people know that, this is what an alcoholic looks like, a recovering alcoholic, I should rephrase. And so, when I saw that what you were doing, that you were, because now I'm working in the functional and integrative medicine niche, and I saw a psychiatrist that's working in functional and integrative medicine, I was like, oh my God, this is like the best of the best of the best. Not only are you a super specialist, but you've incorporated functional and integrative medicine. So I'm just so excited to have you here today. So thank you.
Glad to be with you.
Yeah, so let's go ahead and kind of get into it. So if you could tell us a little bit about your professional background, what led you to the world of functional medicine?
I actually kind of grew up in the world. I was interested in nutrition and mental health in college before I even went to medical school. I was doing papers on B vitamins and schizophrenia, doing yoga and, concerned about lifestyle and health. And then getting to medical school, that all kind of blew up and, eat junk food, and turned out, 9 years later as a psychopharmacologist, just prescribing medications to children and adults. But it only took a few years to kind of realize why I went into medicine and got back to my roots. So, I used to say over 30 years, but when I calculated last night, we're hitting almost 35 years.
Wow.
And I've been able to just keep one foot in the early beginnings of functional and integrative medicine and one foot in traditional psychiatry. So working in inpatient and residential treatment centers, so I can appreciate both worlds. And my goal is to bridge the gap and hopefully educate clinicians.
I love that. What inspired you? I mean, obviously you were into the, supplements and nutrition and all of that in college, but what was like that thing that was like, made you decide to change how you practice psychiatry?
Well, I mean, there are two phases. One is as a child psychiatrist in private practice, uh, all you see initially is ADHD, and the only treatment was amphetamines. So at some point, you start thinking that maybe Ritalin and amphetamines aren't the only path to help these kids that are truly suffering. So that's where I started looking at early on in the 1990s, nutritional and other interventions for ADHD. And then
Ah,
the second major turning point for me was I ended up in the field of eating disorders 25 years ago. And I didn't realize at the time it's the most life threatening illness we have in psychiatry. These children are dying, literally, suicide being the leading cause of death for anorexia. And once I realized it was a disorder of malnutrition, and nutritional and integrative treatments worked much better than our typical treatments, that's what kind of kept me going and pursuing the career that I have.
wow, that's really inspiring. I always say, and I have some friends that suffer from eating disorders, and I always say it's like the hardest addiction because, I don't have to drink, right? But someone with an eating disorder still has to eat. And so it's a very complex disorder. So I'm really glad that you work with that.
Yeah, it's challenging to treat in our current model, which is just, refeeding and therapy doesn't work well. It works for some. And once you integrate a nutritional and functional approach, you can see these kids and these adults, this life threatening illness turn around. So
That's
it is
beautiful.
really important.
That's amazing. I love that. Has functional and integrative medicine influenced your personal approach to health and wellness?
Yeah, absolutely. I think it's been a part of my life for years, and important, for me and my family. That the core of functional medicine, as you know, it's not supplements, it's not any particular practice. It's understanding everyone's different, and those
Mm,
concepts. As a parent, you certainly appreciate it raising kids, but as a physician, when you can see every patient as completely different biochemically, genetically, that's the core of functional psychiatry, and that's certainly the core of our educational platform. You can't just throw a medicine, but just as concerning our colleagues in the integrative world, just throwing supplements. Everyone is different, and that's why the testing is so important.
I love that. You're the first person that's educated me on the true meaning of functional medicine. I mean, I've read about it, I've Googled it, and it's always about its root cause, it's addressing the root cause, it's nutrition. But I love what you shared, that it's really about everyone's different and everyone needs their own specific treatment plan. That's great. All right, so let's dive into a little bit more since this is a podcast for other physicians. Can you share a story of a patient whose life significantly improved because of functional or integrative approach? I'm sure you're going to say what all the doctors say. Yes, I have thousands. But can you give me one that stands out, touches your heart over the years?
Well, since you brought up alcoholism, I'll just share one story of a woman in recovery. She was actually a professional, a physician. Um, and she came to me because she couldn't come off her antidepressant. She was sober and couldn't come off the antidepressant without significant withdrawal symptoms. And when I reviewed the history, I based on my models, I do a lot of testing. So I send her off with kits for blood tests and urine tests and hair tests. But based on that history, I gave her recommendations to take lithium orotate, a nutritional supplement that's over the counter, not prescription lithium, while we waited for the test to come back so we could see what's going on. And she came in, it's usually 4 to 6 weeks later, all the tests come back. And when I ask her how she's doing, she just broke down crying. And I don't know if it was something good or bad, but she was crying. And when I asked her what happened, she said, just by taking this 5 milligrams of a nutritional supplement, lithium orotate, what she said is that she didn't realize how irritable she was to her husband and her adolescent daughter at the time until she took this pill. And we see that with a lot of individuals with substance abuse, that if we don't look at the underlying cause, sometimes it's genetic variants, oftentimes they just need higher amounts of lithium, that the dysphoria and the irritability persists even though they're off alcohol. So, I mean, that I'll never forget. One, because she was a physician, and two, those tears of joy by just taking a over-the-counter nutritional supplement.
That's amazing. That's a great story. Thank you for sharing that. And I know that will resonate with our physicians. So let's talk about the challenges, right? Because it's not easy, right, to go off the traditional model. So I'm sure adopting the new approach, especially you were, really an outlier in those days, and you still are in many ways, because there's not a lot of psychiatrists that do what you do. I'm sure if I went to search for it, I'd only find a couple. So, you know, let's talk about I'm sure adopting the new approach brought challenges. What challenges did you run into, and how did you navigate those?
I kind of had my world of inpatient psychiatry, um, treating, sick adolescents at the time. And then I had my private practice, where I was known as the vitamin doctor. Um, so I kind of had those two worlds for most of my career. And then just by accident, I ended up in the eating disorder world. It was not by choice. I took over chief of a department that had a small unit. And then, for 25 years in the eating disorder world, it kind of put the discussion around nutrition and brain function, in my lap. So I could give grand rounds to academic institutions because my patients with the anorexia were starving. So I could talk about fish oil and zinc and vitamin D and all the micronutrients in relationship to anorexia nervosa. So that
Mm,
kept me in traditional psychiatry. And, people thought I was crazy talking about malnutrition, even though patients weighed, 70 pounds and couldn't walk. But eventually, people started appreciating the role. And now, as you know, everyone's trying to understand integrative and functional medicine. There's
hmm
not a real clear path for psychiatry because psychiatry is still dominated by the symptomatic based approach using medications.
True. What do you wish someone had told you when you first started practicing this way?
I wish I had a better sense of the pharmaceutical industry, and that the studies that were done were kind of manipulated a bit to look a little better than they were. And I just wish early on myself and my colleagues just received training in basic nutrition and lifestyle and all these factors that are now, front page of the newspapers, but not integrated into our doctors' training.
Even to this day, which is surprising. A lot of it is not. Some schools are starting to integrate some of it, but some are bringing integrative and functional medicine physicians in to teach the students. But I don't even think it's like a curriculum base. It's like an add-on, like a nice to
Exactly.
have. If you want to show up for this, go ahead.
It's an elective.
Thank you.
It's a
Thank you.
maybe, and
Right. It's an
it's
elective. It's
more,
not required.
yeah, it's more on the lifestyle and what I call integrative. It's very little to do with functional and testing, and certainly not in our mental health academic programs. I mean, in residencies, I teach a lot of residents around eating disorders, and they get no training in nutrition.
That's going to change because of people like you. So what advice would you give to other MDs, DOs who are thinking about adopting this approach to medicine?
I think it takes time and be patient. And I think be careful learning from Facebook and social media. So I think there are great books out there. There are great conferences, but the more networking you can do with colleagues doing the same work, the easier it becomes. So I think you need a community because this integrated functional psychiatry world is still new, and there are doctors that are going to, question. But once you start seeing the outcomes, it's very hard to not integrate this into your practice.
Yes, I would agree with that 100%. And one of my other podcast guests actually started a functional physicians network, I believe. I'm just going to double check that because I want to make sure that I'm not saying it right. And I agree with you. I think, having these physicians stick together and help one another, as well as doing the curriculum is really helpful. Okay. And then I will double check that, but I want to keep going with you. So what trends in functional integrative medicine are you most excited about? Like what the future, there's so many new things coming online and, new studies and things of that. What's most exciting to you? Somebody that's been in it as long as you have.
Well, I guess I'm going to say that I'm more excited about the old, but the new research is supporting everything that we've been trying to say for 30 years. I just share one story that, I think many of our integrative and functional physicians have been talking about B12 levels, that the current lab slips make absolutely no sense. And too many times someone is considered normal when they have what we would consider low. So I've had this information for 30 years, trying to share it with patients and doctors. And finally, a research study came out, a couple of weeks ago that said the lower end of normal for B12 is resulting in neurological and cognitive symptoms. So I think the excitement is that the research is anchoring the work and the clinical information that we've been able to accumulate over 30 years. And that's exciting.
That is exciting. That's awesome. If there's one message that you want listeners to take away about functional integrative medicine, what would it be?
Well, I'm going to repeat my concept of everyone's different, this biochemical individuality. We do it pretty well as doctors. You go to your doctor and they're going to do a blood test and kind of determine, is it anxiety or is it a heart attack? In psychiatry, we do absolutely nothing. There's no objective test before a doctor hands you a prescription. A good doctor might look at your thyroid, but they're not looking at the 200, 300 biomarkers that I consider essential for functional psychiatry. So the message to me is clearly everyone's different. Use objective testing. Some of it is simple and doesn't cost anything, like vitamin D and B12 levels, and then utilize that personalized treatment plan because everything works better. Psychotherapy works better. And even if you need to use medications, they work better with this approach.
Wow, that's very powerful. I did not even know that about psychiatry because, of course, I'm not a clinician. I just assumed that they ran your blood tests. So thank you for bringing that up. That's really important. And so I know you have, if you could, tell us a little bit about your programs that you have. I know you have one for physicians. It's an educational program. And then I shared in your bio, you have one for the public. If you could tell us just a little bit, a couple minutes about each, and then how people can find out about those.
Sure. Psychiatry Redefined.org. I've been teaching the material for many years, but 6 years organized as a fellowship program. So a year-long training. We have a general program, and then we have a pediatric program that's just starting in May. In addition to that, for those individuals who can't spend the year for that fellowship, we have these intensives, these 3 and 4 week programs. We have one coming up on ADHD, another one on OCD. So we have short programs and long programs helping clinicians understand a functional psychiatry approach. And then we just opened, consumer courses. We have one on ADHD, one on anorexia, and we're developing depression, anxiety. And these are for our patients. And I think if we're going to make change in the system, like for any other healthcare change, we have to kind of empower patients to understand this information.
And what is the website for the public?
That one's called The Mind Refined.
Okay. .org as well?
.com.
.com, themindrefined.com. Okay, very good. And then real quick, just to clarify, because it would be a question I would be asking, because I've already referred a few physicians to you. For the year-long fellowship, is that something that a physician that's in private practice and working full-time, can they do the fellowship, or is it something that they actually need to be in full-time?
No, great question. Thank you. It is made for individuals who are working and have families and have a life.
Okay.
So it is maybe 6, 8 hours a month. Evening, everything's recorded. It's really set up for those that are working. And our program is just not lectures, it's a combination of supervision, an incredible community from 16 different countries, as well as the recorded content. So it's self paced with enough structure to keep everyone focused and learning the material.
That's fantastic. And then at the end of the program, do you have a community similar to what I mentioned? Functional health professionals is Dr. Collar. He was on the podcast. Do you have something similar for your psychiatrists, kind of a community that they can be a part of or they stay a part of after their fellowship?
Absolutely. I mean, I think many of the fellows have described the community as the most helpful resource, learning from others, sharing articles, references, cases. That community has been strong. I learn new things every week. So it's a really important part of our program.
Fantastic. All right, you guys. Well, thanks again, doctor, for taking the time out of your busy practice to meet with us. In addition to your practice, you're also doing all these educational courses. So I know how busy you are. Thank you so much for taking the time to be with us today.
Thank you, Ginger. Keep the good work up.
I will. Thanks.